name is Aaliyah Beard, and today I will be going over the preparation of a gram stain. I can assume that most of us here have been sick before with one of these bacterial infections. A bacterial infection that's very common among adults and children is strep. When you go to the doctor and you present with any symptoms for this, a doctor is going to do their part by collecting a sample from you and sending it off to a medical lab scientist. That medical lab scientist is then going to take that sample and create a gram stain to see if there's any bacteria that are present in you. This technique dates all the way back to 1882 and was discovered by Hans Christian Gram. So, how do you prepare a gram stain? The preparation is very similar to peeing. You're going to need a base, a sealant, a thinner, and a second coat. Your gram staining essentials for this process are a crystal violet dye, a Gram's iodine solution, ethanol, acetone, or a mixture of both, safranin, a microscope slide, cell and fluid samples, and a fluid collection bin. This first step is considered your base coat. You're going to flow the slide for 15 to 30 seconds, and you're going to use the primary stain, crystal violet dye. As the name suggests, this is a purple stain, and it can show up looking anywhere from purple to blue, and it's going to adhere to everything initially. The second step is going to be a Gram's iodine solution. It is composed of iodine and potassium iodide. It is going to create an insoluble complex with the previously used crystal violet dye, and it is going to adhere to the cell walls of bacteria cells. Again, you're going to use this to flood your slide for 15 to 30 seconds. You will follow that previous step with a decolorizer, which could be ethanol, acetone, or a mixture of both. You want to take caution during this step because if you use too much of it or you use it for too long, you can basically get rid of all your previous work from the previous steps. So this step should not take more than 3 seconds at most. It is going to strip the crystal dye from previous steps from thin peptidoglycan layers. If the purple still adheres to the slide after this step, you can assume that your bacteria is gram positive. The final step is going to be your final coat. For 15 to 30 seconds, you will again flood your slide with safranin. This safranin is going to adhere to only gram-negative bacteria cells, and it'll show up anywhere from pink to red in coloration. After this entire process, a medical lab scientist is going to take this slide and examine it under a microscope. So if you look there, again, if it's pink or red, it's gram negative. If it's purple or blue, it is gram positive. The coloration is going to help with the classification of what bacteria is present in making you sick. Once the medical lab scientist has the report, they will go ahead and give it to your doctor, who will be able to provide you with a diagnosis and even treatment, which may be antibiotics. So, whenever you're at the doctor and you need labs done, just make sure to remember that there's somebody behind the scenes who's doing hard work to help your doctor and ensuring that you're getting the proper care that you need.